Hello everyone, my name is Sandip Singh and in this presentation you will be able to learn more about Huntington's disease. The symptoms. Huntington's disease is a progressive brain disorder that reaches its final onset after 10 to 30 years. Symptoms gradually start through this process. Some of the early symptoms include slight changes in balance, involuntary movement, trouble thinking or processing thoughts, and getting irritated easily. During the middle stages, slurred speech and difficulty eating or swallowing may occur. In the final stages of the disease, the person may lose the ability to walk or speak and involuntary movement becomes severe. Gene mutation. Huntington's disease is caused by a mutation in chromosome 4. It affects the ATT gene, which makes a protein called Huntington. Usually, this gene makes a DNA segment sequence CAG about 10 to 26 times in a normal brain. However, for a person with Huntington's disease, they repeat the sequence about 40 to 120 times. Causes. As explained in the last slide, Huntington's disease affects the protein Huntington, which because the gene that it is made from, HTT, becomes mutated and produces too much of the protein. This causes it to disrupt neurons in the brain that could possibly result in the disease. Inheritance and genetic relationship. Huntington's disease is an autosomal dominant disease. This means that only one parent needs to have the defective gene in order for it to lead to the disorder, and also there is a 50% chance of the child getting it. Epidemiology. Studies show that the European population, usually Western Europe, is most at risk of developing the disease. Even having a European ancestry puts you at a higher risk of getting the disease than those who don't. Africans and Asians are least likely to get the disease, but countries like India and China have a fairly high percentage of people with the disease. Onset of the disease usually starts at the age of 40, but its symptoms and progression can start at a young age. Huntington's disease is not a sex-linked trait, so it is equally likely to happen in both males and females. Diagnosis. If a person thinks they may be developing Huntington's disease, they have to go to the neurologist who may ask the person a few questions and must also take some tests to check things like vision, hearing, balance, mental status, language, memory, and behavior. The doctor may also want to do a CT scan or MRI scan to take a look at images of the brain. Family history may also be looked at to predict if the patient may be likely to have the disease. Prognosis. Huntington's disease usually starts and progresses 10 to 30 years before it has reached its final stages. The more earlier the symptoms occur, the faster the disease will progress and become stronger. At its final stages, most patients usually die of complications like heart failure or pneumonia. Treatment. As of now, there has been no treatment or cures for Huntington's disease. Certain medications and drugs can be used to slow down the progression of the symptoms for some time. Therapy is also a possible choice that can help patients relieve some of their symptoms. Speech therapy can help patients speak more clearly and be able to eat and swallow, since the disease affects the throat. Physical therapy can help improve balance, strengthen the muscles, and posture. Occupational therapy can help patients and their caregivers learn how to use assisting devices. Psychotherapy can improve behaviors and help patients cope with the progression of their disease. Some interesting facts. Huntington's disease was named after Dr. George Huntington, who first described the disease in 1872, and about 30,000 people in the United States have Huntington's disease.